your initiative. Thank you very much.
Thank you, Excellency. Now I call upon His Excellency Dr. Jafar Mirza, who also has medical experience, to share his thoughts.
Bismillahirrahmanirrahim, and Assalamu alaikum to honorable heads of state and government and Secretary General SAARC. First of all, I would like to wish good health to His Excellency Prime Minister of Nepal. Your Excellencies, the COVID-19 pandemic is one of the most serious global health emergencies witnessed in the last 100 years. At the same time, when it has been characterized as a global pandemic, it is deemed controllable as well, provided timely and appropriate public health measures are put in place. With over 155,000 infections, 5,833 deaths, and 138 countries involved, no nation and no region on earth can afford to be unresponsive. Least of all SAARC, which is home to 1/5 of the humanity, several of the world's largest megacities, and many of the most densely populated regions. Pakistan shares the common concern over the potential of COVID-19 affecting South Asia. All our countries now have confirmed cases. Mercifully, the SAARC region has so far evaded the worst ravages, but given the experience of other countries in other continents, there is absolutely no room for any complacency. While hoping for the best, we have to prepare for the worst. The World Health Organization's four-pronged advice offers a reasonable way forward, namely, A, prevent, B, detect, C, respond, and also D, conduct research and innovation along the way. Excellencies, Pakistan has been involved in containment efforts right from the outset of the outbreak. We have been alert to the dangers and have put in place appropriate public health measures and developed required protocols and guidelines for the safety of our people. We have been matching our measures to real-time risk assessments. While we have stressed the need for prevention and caution, we have strongly advised against panic. A calm, calculated, and deliberate response is the need of the hour. Pakistan was among the first few countries to undertake a joint external evaluation for the state of preparedness to cope with health emergencies in the context of International Health Regulations 2005. In close collaboration with World Health Organization, we have been taking steps to appropriately restrict movement to and from the affected countries, regulate for flights, institute health screening measures at entry points by member states, and establish quarantine/isolation facilities. Diagnosed cases are being isolated and contacts are being traced proactively. Prime Minister Imran Khan is personally overseeing these efforts. Resultantly, Pakistan has managed so far to keep the cases to a relative minimum, an achievement that WHO has recently recognized as a good practice and has commended it. National Security Committee recently convened for the first time on a national health issue, chaired by the Prime Minister Imran Khan, and has decided to take major steps to contain the spread of COVID-19. The four pillars of our response strategy include: 1, governance and financing; 2, prevention; 3, mitigation; and D, 4, communication. We have decided inter alia: 1, to close all our educational institutions for 3 weeks, close the entire western border for 2 weeks, restrict international flights to 3 airports only, and to ban all large public gatherings, and reinforce screening and administrative measures at the seaports and at the ground crossings. The situation is being monitored closely, and appropriate measures are being taken through a systematic consultative review process. The National Disaster Management Authority has been mandated to lead the interagency effort, and command and control centers have been established at the federal and provincial levels. Effective coordination and surveillance at all levels is critically important. Excellencies, the COVID-19 pandemic forces us to think not in terms of nations and states, but as a collective. If our health systems, disease surveillance systems, and preventive measures are unable to cope, the human and economic cost alone can be staggering. The cumulative impact will dampen region-wide growth prospects and negatively affect the national development agendas. At their current stages of development, the SAARC members can ill afford such a setback. The unprecedented challenge therefore warrants an unprecedented response. We must recognize that the national and local responses still remain the key, and they are the most critical. It is equally important to pursue, however, evidence and science-based responses. Stigmatization and stereotyping is counterproductive. The SAARC Secretariat is best placed to coordinate regional endeavors. With this in view, Pakistan proposes, like other excellencies, that the SAARC Secretariat be mandated to 1. Establish a working group of respective national authorities for health information and data exchange, as well as coordination for responses in real time. And 2, like His Excellency President of Maldives and Her Excellency Prime Minister of Bangladesh, Pakistan would like to reiterate its earlier proposal of hosting SAARC Health Ministers Conference at an appropriate time. 3, reach out on behalf of SAARC countries to specialized development partners, including World Health Organization, for mobilization for technical advice and resources. 4, follow WHO guidelines and implement exit health screening for travelers in the region to avoid cross-border spread. 5, a regional mechanism is proposed to share disease surveillance data in real time about prevalence and incidence of communicable diseases and public health events of regional significance. And lastly, learn from and disseminate the experience of SAARC observer states, particularly China, which has effectively addressed the COVID-19 challenge despite being from where it originated. Excellencies, the challenge at hand demands sagacity, vision, and synergy of action. The strength and resilience of the people of South Asia is well known. We have no doubt that we will overcome these challenges. Thank you, Your Excellencies.
Thank you. Thank you, Excellency. Thank you all for sharing your thoughts on the situation.